As a general orthopedic surgeon, it's great to have some variety. There are some things, though, that I do have some extra training and certification in. I believe I'm the only doctor in the area that has a board certification in sports medicine and also orthopedic surgery. So I'm lucky enough to take care of quite a few of the high school athletes in the area. And I enjoy that part of my practice. I grew up as an athlete and have kids that are athletes, so that's a very fun part of my practice. And I like getting those people back in the game because I can understand that. I've played college football. I had injuries. I had surgeries. I understand what it's like to be back out there, and I still enjoy being active. Well, one of the areas that's had a significant advancement, I believe, is in hip replacement, and particularly using the direct anterior approach to the hip. And in that approach, it's the one approach that you can truly just split muscles apart and get right down onto the hip joint and subsequently perform the procedures related to the hip and putting the implants in. Early on, as I was beginning to use this approach, and it was a little bit harder for me, harder than typically where I came in from the back of the hip. But on one of the first 5 patients I did, I walked into his room on the second post-operative day, and I asked him how he was doing. He said, "Well, I'm a little bit sore," which was to be expected from a fairly big procedure. But the gentleman got up from a seated position without using any hands and managed to walk over across the room to just shake my hand and tell me thank you for what I did for him. And it was right there I knew that there must be something different to this, and this is going to be a better thing for my patients. Other recent changes in particularly my practice for total joint replacement is in pain control. That's what keeps a lot of people from having the surgery. But over the last year, I've implemented a multimodal pain management regimen where we use a various number of medications given at specific intervals to help minimize the pain. So we're trying to stay ahead of the pain. I've had some experienced floor nurses come to me and tell me that, "Hey, we like what you're doing. We like to see your patients coming to us because we know they're not going to hurt." I was very excited when Surgical Hospital Jonesboro became part of the NEA Baptist system, and it's one of the places that I perform my surgery. For a patient experience, it's second to none. It's really a boutique type hospital. Patients come into this one-level facility, come right into preoperative holding, and then the operating rooms are outstanding. We've seen people get off walkers, canes, and increase the range of motion without a lot of discomfort that people have experienced in the past.